Welcome to the Digital Health and Innovation Podcast, a publication of the Southern Medical Association. This podcast will educate and inform listeners on the various systems and methods that use information, data, and communication technologies to help resolve problems, reduce inefficiencies and costs, improve access, increase quality, and help make the practice of medicine more personalized and precise.
Good afternoon, everyone. We have a pretty great topic for you today that is very intriguing, pretty innovative. It's a combination of telemedicine, lactation, and nutrition consulting. I'll wait for our expert to take us on a little deeper dive on this topic. But before that, my name is Andy Mohan, and I am the co-chairman of the Division of Digital Health and Innovation for the Southern Medical Association. And I'm joined by Miss Jennifer Price, who's the educational manager for the Southern Medical Association and our moderator. We have with us today Miss Michele Behme, who's the CEO of Sonder Health, is an RN with a clinical background in behavioral health and greater than 25 years of healthcare IT management consulting experience focusing on electronic health records, clinical transformation, executive advisory, and virtual health services with leading consulting companies. She uses her clinical and operational and consulting experience to translate the language of healthcare and information technology so clients can focus on efficient, optimal, quality of care delivery for their patients. First of all, I want to take this time to thank Ms. Behme personally, and would like to thank her on behalf of the Southern Medical Association for joining us today. So Jennifer, would you be kind enough to kick off the discussion and get the ball rolling?
Absolutely. And first, let me thank you both for joining us today. I think this is going to be a wonderful conversation, and I appreciate you both giving your time today. So thank you.
For allowing me to join this show and to share some of my passion about the telemedicine services that we at Sonder Health provide. I'm really excited about joining and seeing if I can share some knowledge.
Well, let's get started. And why don't you tell us about Sonder Health and its relationship to the telemedicine space?
Okay, thank you. So simply put, on a day-to-day basis, Sonder Health is a virtual group practice. If you think about services, quality care that we deliver when and where patients need us the most. It doesn't matter what time of day, it doesn't matter where they live, it doesn't matter what type of mobile device that, can be a computer, an iPad, a phone that they are connecting with us. We serve a need that covers a lot of the barriers to receiving care, a lot of those social determinants of health, those food deserts, those maternal and OB pediatric deserts where there's no access to care. And we do this through our own group practice and then strategic partnerships. We are not a technology company. Our services sit on top of any platform. So if the hospital, healthcare system, ambulatory site, employer group, if they have American Well, MD Live, Teladoc, whatever technology platform, we can work with their services. So we kind of like to think of ourselves as a powerhouse of experience. We have in our ranks, we've got a combination of more than 50 years of clinical experience, management consulting, healthcare IT advisory services, and we'd like to use this to help transform the way that healthcare gets delivered. We have, over the years, we haven't just watched telemedicine evolve, but we've been an actual part of it. Telemedicine has been around for a long time. I know back in my behavioral health days, they were talking about telemedicine visits, and this was before we even had a great electronic health record system in our space, but they were talking about it back then. At Sonder Health, we've also been at the forefront of change. We've been helping to lead the way in order to achieve a singular goal. Basically, we're here to provide evidence-based healthcare solutions so that women and their families can thrive. It's our passion that keeps us anchored to that primary mission. And so whether we're helping clients leverage the technology that they've purchased in order to increase their outcomes, grow their revenue share of referrals. We work alongside of them and their partner, and their partners, their clients, their patients, and the end result is always life-changing care. Our company started in 2015, and our leadership team is comprised of clinicians. We have a physician, myself, I'm a nurse, and our president is an IBCLC. There was two co-founders, Dr. Sylvia Rom, and she's currently the Chief Innovation Officer at Atlantic Health, but prior to that, she was the Chief Transformation Officer for American Well. And she also is a board certified pediatrician and a lactation consultant herself by background. And Lauren Majors, who is an IBCLC, and she serves as the president of our company. And those two women got together as a result of a gap in care that both of them, coming from a clinical background, realized that if they were having problems in the lactation space, that there were a lot of other women were as well. And so in addition to being clinical, Lauren and I have a strong healthcare IT EHR consulting background, and combining all of that with healthcare IT, the technology, the advancements in EHR, the technology, the growth of telemedicine, it was a really good fit for a very passionate group of women to start this company. And I have, in addition to the consulting background and clinical, I have that behavioral health background that also helps in a lot of these situations. So then working for us, we have a team of international board certified lactation consultants and registered dietitian, and they're part of a virtual group practice that they're ready to see our patients through any type of mobile modality, computer, through live video telemedicine visits. We also, when needed, we have nurse practitioners, we have physicians, consultants. We cover all 50 states. We're dual providers, meaning that some of our international board certified lactation consultants are also registered dietitians. And then we also have a large group of our practitioners that are multilingual as well. And so if you think of us as, if you think of the brick and mortar practices, we're the same, only we're virtual providers. We have all the same workflows from registration to dropping claims. It's just that we get to see our patients when and where they need us the most, and otherwise they might not be able to see, have access to care. And so access to care, there's a shortage of specialists in the hospitals and healthcare systems today. And so people are turning to telemedicine to put the patients, in front of those providers, as I said, when and where they need them. And we have our own group practice, but we also have channel partners that we work with. So we provide services to hospitals, health systems, employer groups, health plans, and then direct to consumer. So in a nutshell, that's a little bit about Sonder Health.
This is
very
wonderful.
interesting. Go ahead.
Oh, no, I was saying that is a wonderful place to be and a wonderful service to provide. I mean, this is fascinating. So, Andy, I'll let explore it a little bit further.
It's very, very interesting to hear, because a lot of us, we know that there's a lack of access to providers. I mean, when you think of providers, you're thinking about clinicians, your mid-levels and those kind of things. But to not have access to, I didn't know that there was a lack of registered dietitians, lactation consultants within a healthcare system. Is that something that you think is prominent throughout every single healthcare system throughout the United States, or is it something that has to do with the size of the hospital? How did you guys identify that there is that lack of care?
Well, to be an IBCLC, you have to be certified and licensed, and you have to, just like a physician, nurse practitioner. So there are professional organizations, and so much like physicians, when you know that there's a shortage because of the rural health, setting, or finances from the size of the hospital or the type of hospital, those are things that we have metrics around through the national associations on how many IBCLCs are licensed per state. And then you take that by, there's a lot of data out there on how many, just like we know how many beds are in a hospital, how many physicians are in a hospital, we know how many nurses, how many dietitians, how many IBCLCs are in hospitals.
Right.
And there are statistics around baby-friendly hospitals, which is a certification that is somewhat like Joint Commission, but it's around the mother-baby, and they have standards on how many IBCLCs need to be staffed at any given time for a hospital. And so a lot of hospitals will that are not baby-friendly hospitals, they haven't gone through the certification, they will use their nurses that are in the OB postpartum area as, a lactation consultant, and there's lactation educators, but the IBCLCs that we use, they are, they have to go through a stringent educational course, clinical time, and certification exams, and then they have to keep up their certifications with continuing education. And so we know that it's small hospitals, of course, don't have what they need most of the time, but you'd be surprised how many large, even academic institutions don't have the number of IBCLCs and registered dietitians that they really need to have, according to the standards.
It's very interesting, Michele.
Do patients like this service, and why do they, do you think?
Well, I have to say this is something I'm very, very proud of, and I owe it to our president and our team members that provide the service. But we have patients really do love the service, and it's almost unprecedented, and it sounds a little bit crazy, but our net promoter scores have been 100, and our providers, the stars rating have been 5. And it really, like I said, it's pretty unheard of. We have testimonials from our patients and from our clients that are our partners, and we document those, the ones that, it's really more helpful than I thought it would be, and I feel so much better. I didn't know you were going to be this thorough, and I had no idea this was the kind of help I was going to get. And it's, we have actual testimonies from when the mom first came and some of the challenges that she was having, and then the follow-up subsequent visits and stuff. And so, we really do have a lot of metrics and a lot of documentation on the satisfaction. And, a lot of these patients, they're seeing this virtual technology is new to them a lot of ways. It's a new way to access and receive care, and once they get into it, they end up really loving it, because you think about a mom who at 2 o'clock in the morning is, up with this stressed, she's stressed, she's tired, the baby is not feeding, and, is fussy, and they just don't know, or maybe she's got the beginning stages of like mastitis or some type of infection going on or something, and she's kind of at her wit's end, and she gets an appointment because we're very easy to access, and she sees, a smiling IBCLC who helps her take care of the situation and gets her calmed down and assesses the situation and makes a plan. They have follow-up. She has referral capabilities. You know, a lot of these moms have been passed around from their peds office says, no, go back to your OB, and your OB says, no, go to your WIC program, you know, no, go to, you know, the Lactation League, whatever the case may be. But by the time that mom sees us, sometimes she feels like she's been a ping pong ball, you know, where she
already has emotions and hormones and everything, and that's just another layer that of frustration.
Yep.
Absolutely. Absolutely. And I think the other thing is that, you know, you take that kind of situation where the baby is not latching properly and there's that frustration, and then, you know, maybe she does have some mastitis going on and stuff. So she can see that lactation consultant. She can help her with the breastfeeding challenge, and then she can get her referred immediately to a provider to be seen for the infection. So you've got that warm transfer from you know, the IBCLC to the next provider, and you see both mom and baby. And you can do this from anywhere. That's the beauty of it. If they have their phone in their pocket or they have their iPad, you know, it's easy and accessible, and you and your family can see a provider at any point. You know, when we have not only the patients that like our services, but, you know, the consulting side of things that we have, you know, we've been in hospitals and healthcare systems for a long time, and we know from the employer side and, you know, the benefits side what a lot of adults are looking for. And it's, you know, there's a lot of wellness programs, a lot of wellness benefits and stuff, so that the nutritional side of things, obesity, some of the comorbidities that a diabetic has, that type thing. So we can see moms, you know, prenatally all the way to geriatric, and we can see, you know, their spouses, their sons, their brothers, whoever, you know, for the nutrition side. And so we work with providers and insurers, and you know, we really feel that we're helping to deliver that quality care. You know, we're in the business to decrease the cost of health care and help organizations get more referrals in and keep their patients, not suffer from, you know, leaking their patients out to someplace else. Because we know moms, that especially those of the childbearing years, they're primarily the drivers in their family's healthcare decisions. I mean, they're kind of the CEOs of the house, and this is the demographic that we have really chosen to target, and the offshoot is, you know, all the other ages. But we can offer a service that really speaks directly to that demographic, you know, of the childbearing years and some of the challenges that they run into. So, you know, and we have actually worked, you know, across barriers. You know, we have, you know, commercial, Medicaid populations. You know, it's you know, a very diverse group, and we have a very diverse group of caregivers on top of it. And so hospitals and health systems really love us for our ability to provide care continuity and, you know, extend that capacity of their frontline in-office staff, and, you know, supplement their staff in some cases. But they like that care continuity that their patients are being able to see. And then you know, it's support for their families, the employers. They love it because, you know, employee retention, job satisfaction, it reduces absenteeism. If you think about the new mom that we can help, you know, prenatally even get her set up so that she has plans for when she's going back to work, and how is she going to pump, and is she in a breastfeeding safe environment? Is she in a breastfeeding friendly environment when she goes back to work? Is her HR department helping? So this is, you know, while telemedicine is really growing in all areas, you know, primary care, dermatology, behavioral health, all of that, The lactation space and the nutrition space are, the lactation space especially is a pretty niche market, but it really gets to a lot of the other patients in that family or that dyad that need to be seen. And so, you know, there's not only increasing interest, but, you know, people are getting more and more understanding how you don't have to be physically hands-on to make a difference and to provide care. I mean, if you have a tongue-tied baby, say, you know, you can get pictures, you can have a live video where you can look at that infant's mouth and stuff. The only thing you cannot do is physically put your hands on that patient. But it really is
It's the convenience.
you know, consumers.
It's the convenience of it. I think that patients would love
Yeah.
something like this. It's just the convenience. You don't have to go to a doctor, you know, get in a car, drive over, you know, blah, blah, blah. You can do it from, like, you can do it from your own home. And it's just, the access is great.
In your pajamas.
What's that?
In your pajamas.
In your pajamas. I like it. In your pajamas. So it's the access is wonderful. The fact that they can, you know, they can see someone immediately. You know, you mentioned the access. It's pretty simple. You know, you get on your phone or you get on a computer, but when you make an appointment, how quickly is the turnaround time? Is there something where, is it like a 24/7 service? Is there someone like ready to, you know, to help you out immediately, or is it has to be scheduled out? Because if it is something at like 3 a.m, is there someone on like that you'd be able to see? Is it that? Is the access that simple?
Yeah, we actually do have 24/7, and I do have to say that it depends on the package that either their employer purchased from their insurance group, or if it is you know, some other organization that is purchasing these services. They may say, we only need people, you know, 16 hours a day available. Other organizations, they want us to have access 24/7. And so, you know, they sign up through the app, and it depends on if they're going through their insurance. You know, we may be white labeled through that insurance, or will they go through our own group practice? And they download the app, they register, they, you know, with a username and a password, it unlocks our services. They can schedule an appointment, time, date of their choice, and then they can look at the profiles and hand select the person that you know, they like their attributes, they like the qualifications, they might like the, you know, how friendly they look, you know, what it's all a personal preference, but they can hand select their person that is available to them. And you know, it is ease of access. I have to say, we've been doing this now for a while, and we've tried to take out as many barriers and as many obstacles. And, you know, just like with the EHRs, you know, Andy, you know, from being in the hospital and documenting and stuff, it's all about the clicks and the number of clicks and how long it takes. You know, it's the same thing with us. We want to make sure that they can get to us right away, as, you know, as they need it. And then they can schedule their follow-up appointments at their convenience, you know. So it's it definitely, we're taking a lot of those obstacles out of the way, and, you know, helping organizations meet their goals too while we're doing that.
That's wonderful, Michele.
You mentioned quality care and providing that, and it sounds like you are, and you even kind of touched on the feedback you're getting, and so you kind of have a sense of how this is being received. Would you like to expand on that a little bit, or are there some additional thoughts you would like to share regarding the quality care?
Oh, yes.
Validation of what you're providing?
I'm really passionate about this. You know, being a nurse, and you always want to have, you know, the best for your patients, your, you know, their families. And I have to say that we did our due diligence in really researching the clinical content specific for our specialties of lactation and nutrition. We developed clinical pathways that are specific to telemedicine. And we've taken the best of that clinical content for lactation and nutrition. We've tweaked it, like I said. And that is, you know, we have documentation tools, we have quality care, you know, that is delivered. We have a review process that we have in place, just like if we were a bricks and mortar. We look at, you know, all of the documentation. We have access to any kind of feedback. Should there ever be a poor patient experience, we have channels that we can go back in to that particular situation, just like you can in the electronic record, and you can go back to the audit, the date and time, find that root cause. To date, we have not had to go back and do that because of a problem. We've gone back and done it because we do our quality checks, but we really feel like it's because we set it up with a lot of thought and a lot of strategic focus on how we were going to roll this out for telemedicine. The other thing that we have, telemedicine is, we have emergency management protocols. And so we have systems in place where that patient is seen, that's where if there's a 911 call that needs to be initiated by the provider, that it is in the place where that city and state where that patient is. It's not where the provider is, but it's where the patient is. And then the online tech support, they guide the provider through the whole process and stay on with them through the whole time till that patient is secure and set up with a 911. And so we feel like, you know, we've done thousands of virtual health and lactation visits, and we've discovered a lot of lessons learned. And we've shared that with clients on, you know, when they're starting up their services, you know, some of those gotchas or some of those painful things, you know, we've really passed that on so that they don't have to repeat some of that. But we also feel quality and patient engagement. That's a measure for success. I mean, that's if you have an engaged team, an engaged patient, client, and you have the quality to back it up. It's you know, it's just like the ease of access. That's a patient satisfier. But when they know they have clinically driven, evidence-based background, clinical content that's guiding our team members, you know, and the assessments that they do, then, you know, they feel so much better about knowing that we're not missing anything. And, you know, there's a lot of organizations that, you know, want to do this, but it's, they may not have the resources to help with that, or they may have a lot of challenges with, you know, they've got the technology, but they don't know how to expand the service, or really how to do a marketing analysis of where would the next space be that could utilize this service, so our patients are not gone. But quality is something that's very near and dear to my heart. I know it's from my nursing background, but it's also that we're very, very proud of the people that we hire and the vetting process that we go through and the partners that we partner up with, and the clients that we take on from health, you know, the different health systems and employers and things. So we feel very good about that.
That's fantastic.
Yeah, you know, Michele, you're a forward thinker and out of box thinker. We need more people like you. The stuff that you've been a part of, and a lot of, and not just this. You're always doing something unique and trying to make a change in healthcare. And you know, we're thankful that we have people like you to improve the quality.
Oh, good. Thank you. I'm glad my passion shows through. Maybe a bit too much, huh?
I'm glad that you're not practicing, you know, you're not clinically practicing right now, and you're involved in a lot of these things to change things, you know, to make it better for, you know, clinicians and patients, to make it easier for them. So that,
you know, and I think I keep up my a little bit of consulting on the side with the advisory services, and I'm in the hospital still with them, and so it does help. And we're very heavily involved in our state rural hospital association. We're involved in the national breastfeeding coalitions, you know, things like that. We've our president has been a fellow with the Rural Hospital Association and stuff, and so there's a lot of state initiatives where I live that we have really, really bad infant and maternal mortality rates, and we also are, I think, 40th in the unhealthiness of the state in terms of obesity and comorbidities. And so our services are just, you know, we could stay in our state and never go anyplace else because there's really a lot to be done here. But we are national, so that's, you know, that's good. But it's kind of interesting how we've blossomed in utilizing the healthcare background, the clinical background, the IT background, and kind of combined it all.
We've touched on quality. Are there now regulatory and reimbursement barriers? And if so, how do you best address those?
Oh, those are complex questions. This is such an area of tremendous potential, especially in the rural and underserved areas. And there has been, there's proof that telehealth and video conferencing technology, you know, really does help in cost savings, time savings, and increased access to care. However, the regulatory requirements are constantly in a state of change. Reimbursement doesn't have to be a barrier, but every state's different. And so with telemedicine, and there are regulations in place for both the commercial and the Medicaid populations. Providers, they need to be aware of these regulations and requirements so that they can develop their programs in the state that they wish to practice, but they know what those regulations are. And one of the very best resources out there is the Center for Connected Health Policy, and it goes by the acronym of CCHP, and it's a program that lists out literally all of the rules by state, subdivides them by commercial and Medicaid payers, and it's an offshoot of the Public Health Institute. Mm-hmm. And it's an aggregation of all the data at every state level, the definition of telemedicine, whether it's synchronous, asynchronous, remote monitoring, video monitoring, video visits, all of that. And so it's a place where the policymakers, the health advocates, any of the healthcare professionals can go and really learn their telehealth laws, regulations, and Medicaid policies. And I think the last one was the fall of 2019. But their website is absolutely phenomenal. It's constantly being updated. It doesn't have outdated materials and stuff. There's about 200 bills that have been pushed through regarding telemedicine, and there's evolving and constantly changing landscape. And just when you think you know something, there's a high probability that it's going to change. So you do have to get out there. But the main thing is when you're talking about a barrier, there's regulations and there's the financial side. And the main thing is that people need to be aware of is that every state's different, and just because one state has or hasn't enacted particular rules doesn't mean that your state, that you can't submit something for reimbursement. We have actually had plans, hospitals that have gone back to their health plan and insurance and show, the good case, the good use case for providing a telemedicine service, and they've had the plan changed. And so if you're thinking about, you know, well, insurance is not going to cover this and stuff, you would be surprised. And it's ever changing, and they understand the professional boards that license the personnel that provide the service. They understand and they get the fact that this is decreasing the cost of healthcare. It's decreasing readmissions. It's decreasing emergency room visits. It's, you know, decreasing the infant mortality rate, which is, you know, what we're wanting. And so it's, even though there's areas that are slow because of the regulations and stuff, the coverage and the payment, you do have to work it. You do have to know what you're looking for, and you do have to reach out and show a use case. And there have been changes made where they can, you know, they end up covering a service. So I think that, you know, employers are seeing the investment, you know, the access to telemedicine and access to care. And, you know, like I mentioned before, you have, you know, happy employees, and you have decrease in sick days, and, you know, it's a return on investment in a lot of different ways, not just in a financial way, but there's a lot of other positive. So don't let the reimbursement scare you off or to be a barrier, because it is, it's ever changing and ever accepting more and more.
Andy, do you have any points you would like to delve into with that?
I have nothing right now specifically, but, you know, I just I appreciate the time that you took with us, Michele, and it's just it's a very interesting topic. I don't think a lot of us know about this. Patients just being educated on this topic, and, you know, what's going on with telemedicine, the access that now they could have, and the convenience to them to access someone like this, these professionals. It just makes things so much better. And it's, I think, this kind of continuing process of leaders like yourself, Michele, to educate and to create environments and create these different businesses to help healthcare and to prevent these readmissions and to prevent the, you know, reduce the infant mortality rates and be a part of the whole process. It's going to make it'll make it better for us all. So I really appreciate this discussion and to educate not only myself, but I think a lot of us that are going to be listening to this.
You know, it's interesting you bring up a good point there. And I was just at an Indiana Breastfeeding Alliance meeting yesterday, as a matter of fact, where we're setting the goals and objectives for the state for the next 5 years on what we're doing in the breastfeeding realm and stuff. And one of the big things is education, especially for pediatricians. And a lot of the, even, you know, myself as a nurse, we didn't have a lot of breastfeeding, you know, the importance of it. And, you know, it is baby's nutrition and stuff. And so, you know, if we want a healthier society, we have to get to the people that are providing the services and educate them. And, you know, you'd be surprised, pediatricians, what they don't get in school. And so we're talking with some of the medical schools and adding curriculum, some of the nursing schools, you know, various things like that, because not only is it telemedicine, but it's the, you know, why should they help this mom get connected to a lactation consultant? And so it's really, it is really kind of fun and exciting. So thank you so much for having me. I appreciate it.
Thank you.
Oh, thank you very much. And before we wrap up for the day, if there was one piece of advice, a final takeaway or a pearl of wisdom to share with our listeners, what might that be?
Oh, I think you know me by now, Jennifer. One thing, that's hard for me to say, but I think know your space, know your regulations and what applies, what type of credentialing process do you have to go through to provide this service, and when in doubt, Sonder Health is there to help you. So.
I have one other thing I'm just kind of curious, and I guess we can discuss this later. It's not, I don't, but it's something so for like a person that you mentioned a phone, is there like an app or something that you would download to go through the process of accessing a consultant, or how is or is it you have to go? Is it web based? So you have to actually go through the the URL.
There's an app, and then you also can do it on your computer too through the web. Either one.
Okay.
Yep. Yep. And it's easy, and like we said, we keep it to where it's you set your account up really quickly, and there's if you're using your insurance, or if you're fee for service, if you have a coupon, there's various ways to access it, but it's very quick and not a lot of steps to get into the system.
That's tremendously awesome.
Okay. All right.
Thank you so much to both of you for spending time with us today. And this was really a very fascinating conversation. Telemedicine is something that intrigues me. So I appreciate you both taking some time to discuss this and share some of the various aspects with us.
Oh, absolutely. Anytime. It was a pleasure, and talk to you soon.
Thank you for joining us. To subscribe to additional podcasts, visit sma.org/podcasts.